Pleasure to be with you tonight, and I just want to thank you all for coming. My name is Stuart Frost. I practice in Mesa, Arizona, and been in practice for about 16 years. I want to tell you, I live by 3 core values, and I know that many of us live by values and core values, and one of those core values that I live by is being happy. Another one is hungry or passionate. The last one I try to remind myself every day is that I'm grateful, and I'm grateful that I have this opportunity to do this webinar with you tonight. We are going to talk about case management principles using micro-osteoperfurations for accelerated treatment. And this is my email. You're welcome to email me after the presentation if you have questions. Things that I don't cover. What I've tried to do is put together a presentation that will help you. It's based on an introduction to micro-osteoperfurations or Propel. And what I've used this in my practice for is really to increase the predictability and accelerate my orthodontic treatment. And what we're going to focus on in this webinar is mostly using Propel with brackets and wires. And for me, I use the Damon system, but this applies to all brackets and wires. So you might ask yourself, the question is, why is this important? Why do we do this? And I like to think about these things. And we live in a time where our profession is constantly changing. We're being asked to embrace new technologies. And why do we do that? To enhance our patients' experience. These new technologies are benefiting our patients and increasing our efficiency and shortening treatment times. I think that's the key for me, is that we can help our patients be in braces less, and it can increase our efficiencies and save us money. My goal for this webinar is, by the end of it, I hope to show you a simple way you can start growing your practice with accelerated treatment, and most specifically Propel. And we're going to go through the basics of this, and I'm excited to share with you what I've learned. I want you to know that I'm not employed by any dental company. I have a private practice here in Mesa, Arizona. I do have stock in the following companies, and I think it's good to have this disclosure. I have stock in OrthoFi and Oral 4D. Not really going to talk too much about Oral 4D. I will OrthoFi at the very end. I don't have any family members employed by Propel or any stock in the company at all. I'm simply a consultant for them. I've consulted for or evaluated products for the following organizations: Propel, Ormco, Acceledent, ICAT, Wave Orthodontics, and Oral 4D. And so with that disclosure, let's get started here. You know, there's a lot that's being said today and what the future of orthodontics holds for us. And for me, my opinion is that it really comes down to accelerated and innovative orthodontics. That's where I see the future. We have the best technology we've had in years. If we want our practices to continue to grow and succeed and be efficient, we must change with these exciting times. And I got to tell you, these are exciting times, and things are rapidly changing in the field of orthodontics. We must be more efficient with our treatment and have the best outcomes than we ever have before, because of the competition that happens in our communities and with the changing times with companies trying to bring orthodontics direct to the public without us. So I think it's an exciting time, but it's a challenging time as well. So what does this mean to us? I got to tell you, this is Dr. Dean Degoni. Dr. Degoni was the Dean of University of the Pacific when I was in dental school there, and about 20 years ago. And Dr. Degoni practiced for many years. He was a periodontist, a pedodontist, and an orthodontist, and then the Dean of our dental school. But basically, in one of his commencement addresses, he shared with the dental students that were graduating his thoughts, or the thoughts of the dental community 65 years prior. The thoughts back 65 years prior were that high-speed handpieces destroyed nerves. Now we know that they're routine at every dental chair. Implants would cause bone infections or fail. We know that's not true. The thoughts during that time was that fluoride would cause cancer. orthodontic surgery would cause the loss of a maxilla. And we know that these thoughts have obviously changed. Why do I bring this up? Well, about 2 years ago, I was at the University of Pacific at the ortho department, and we were celebrating Dr. Dugoni's birthday, and I was teaching at the university in the orthodontic department. And I look over, and I think this was his 91st or 92nd birthday. I look over, and what do you notice he's doing? Yes, he has his iPhone in his hand, and he is texting or doing something, probably on social media, Instagram or Snapchat or something, but he's embracing technology. Really, that's what this is about tonight, is embracing technology. If we're going to be able to differentiate our practices, it's going to have to be through innovation and technology. That's where I feel like that we can really make a difference in our practices. So with that, let's get into the presentation. Let's talk for a few minutes about the science behind micro-osteoperfuration. Basically, we know that when we perforate the tissue in the bone, we cause an inflammation. And the cytokines are increased to that area, and we know that those are small proteins important for cell signaling. So we get an increase of cytokines. That makes the rate of bone remodeling increase, and then bone density decreases. It's simple bone biology. Create a wound, and things start to move faster. How does this really work? In orthodontics, we know that the rate that bone remodels really determines the speed of tooth movement in a patient's treatment time. We know that decades of research have been refined into simple and easy in-office procedures using these micro-osteoperfurations. Moving teeth faster now is easier than ever before and clinically proven safe. And these are articles that have been written in the journals. Dense bone will temporarily become softened internally. This will be undetectable to the patient, but allows us, the orthodontist, to use movements that occur faster. And when incorporating these micro-osteoperfurations into the treatment, we can move teeth almost twice as fast. We're going to talk more about that. A simple little cartoon here talking about bone biology and how teeth move. We put a tension on a tooth. That puts pressure on the side that the tooth is moving. We get a vascular constriction, and we get disorganization of the fiber, decrease of self-proliferation, and the teeth start to move. Here it is again. We get frontal resorption on the pressure side, and the bone starts to remodel. Now, we know this is simple bone biology. It's taught to us in our first year of orthodontics. Now, what some of us have found out, including myself, by sad realizations, is that if we use too heavy of a force and we cause our tooth or the bone biology to have undermining resorption. And obviously we get a decrease in the blood flow and vascular obstruction and necrosis. And that's not what we want. We want to move teeth with as much health as possible and as quick as possible. So we're going to talk about that. You've seen this before: resorption, reversion, formation, and remineralization of the bone, and that's that simple process of the bone biology and bone remodeling. Now, let's talk about an important study here from New York University, and basically published in the AJODO. The study utilizes the Propel Micro-Osteoperfuration to create these little wounds, and they found that this really reduced treatment time by 62%. Clinical trial demonstrates 2.3-fold increase in velocity of tooth movement. Now think about that for a second. All of a sudden, all these adults that we're now showing up to our practice, and they want treatment, but they want it in under a year, and they want it to where it doesn't hurt as much, and they want it to be safe. We now have something that can really impact their treatment. Clinical trial demonstrated 2.3-fold increase in the velocity of tooth movement, specifically in canine retraction when using Propel. bodily movements, and this is, I think, is so important, bodily movement was shown without that tipping, or as we showed you before, without that, you know, hyalinization of the tooth movement and causing problems with our tooth movement. So we don't want to hit our patients with a bigger hammer. We want to use less force, but do it in a way that we can move teeth faster. Patients reported little to no post-treatment discomfort. What a great study. So it's with that we go on and we look at a little bit more of what this study entailed. And you know, at the time of treatment, the left side was treated with the perforations, and the patient's right side wasn't. 24 hours post-treatment, note, soft tissue is completely healed, if you look at it. And then under number C figure, we've got day 28, left side is significantly more canine retraction than on the right side. And then you can see with the occlusal view right here, more retraction of the canine. Now this is what I see in my practice when I use Propel. And this is not an anomaly. This isn't something that doesn't happen every time. This happens every time. Let's just take a few minutes here. I think it's important to talk about accelerated treatment in the different modalities. Now, accelerated treatment is not going away. In fact, more companies are joining this whole revolution, if you will, and joining in. And some of the most common that that we're aware of and I've used, one is vibration, and you know, we use a rechargeable device. The patient's required to self-administer this 20 minutes a day, and I think there's a place for this in my practice. Relies on obviously the patient has to do this, and the cost can be varied from $600 to $900 per device, depending on how many you purchase at a time. There's other, as you can see on this other side here, there's other contraptions. I'm not aware of what this actually is, but I'm aware of light activated bone regeneration, and I have a couple going in my practice. But this device is with a headgear and 20 minutes a day. And you can see there's other devices that are going to come in and come into play in our practices, and we need to be aware of what those are so that we can choose specifically for our patients what can benefit them. Let's talk about this for just a second. This is doctor-controlled accelerated orthodontics, and although I've never done any of these procedures on my patients, this is obviously corticotomy, and this is, of all of the accelerated orthodontics, the most invasive, time-intensive, requires patient's recovery time. There's a high cost involved for the periodontist or the oral surgeon to do this procedure. Requires extensive training for the clinician, and basically going and scoring the bone is creating that wound, and the wound healing is starting the cytokines and that whole process of you know, causing the bone to be less dense. That's extreme. Now, there's other procedures. Again, I've not done this with any of my patients, but I'm aware of this in the literature and from others showing cases. This is piezo electric surgery. And this is a little less invasive than corticotomy. Still requires a flap or a tunnel procedure. Requires a patient recovery time. You still have recovery from it. Again, there's a high cost to the patient and requires extensive training for the clinician. And so I've seen cases done here, very efficient. Teeth move very quickly. So which then brings me to why we're all here tonight, to talk about micro-osteoperfuration. Which is a huge benefit to us in our practice because there's no patient recovery time needed. Low to no cost to the patient. The training for the clinician is minimal, and the best part about it is it's topical anesthetic for most areas in the mouth, and you're doing it yourself, and you're not sending them out to somebody else. You're in control. You know right where you want to do the micro-osteoperfuration. So there is one other one that I wanted to bring to your attention that is exciting in my practice. This is a patient who came in for treatment, and obviously she has a mid-face deficiency and slight underbite. I won't show you this for talking too much about the case, but mostly just to tell you that this is a surgery first case. We put the brackets on, and you know, within a 2 weeks to 3 weeks period of time, we go to surgery and we move the jaw forward, and then very quickly, with having those cuts and that wound-induced surgery, teeth move very quickly into place, and you can see that you know, here she is at 4 months after we put TMA wire in, and we're finishing this case up. Here she is with a maxillary advancement is what she had done. And so there's another part of this that does require surgery, but it makes a case turn out very, very nice, and 7 months of treatment time with surgery and lining everything up. So these are the areas that are in our practices where we're using accelerated treatment, and you can see she has a beautiful result, increased her mid-face and her smile. You can see almost 100% of her incisors now, and just it's amazing to me to see the difference after a surgery, and especially this surgery first. You can see her eyes are more alive, and her face is she looks more awake, which is fantastic. But tonight, I'm going to focus the rest of the presentation on micro-osteoperfuration devices, and specifically what we're using here with Propel. And this is where I was introduced to Propel, and this was the first device that I used in my practice. And this creates the micro-osteoperfuration and stimulate that natural cellular response, really harnessing the patient's own biology to accelerate the tooth movement. Now, this device on the left is a driver. Within the driver is our what causes the wound, and this one has a depth limiter on it. I'll talk in a few minutes about what depth we use in what parts of the mouth. And the cool thing about the device is that it has a nice little light that turns on. When you set the depth to a certain depth, let's say 3 millimeters, when you penetrate to 3 millimeters, you get a nice red light that comes on, and you know you're at your desired depth. So we have the surgical steel construction in our temporary anchor, or a tab, if you will, and our surgical device. It's conveniently packaged for a single use. Ergonomic design, it's easy to use. The only thing that I saw is that this retractable sleeve did get into the tissues a little bit and was a little cumbersome. Since then, we have other devices that have come out. I'm going to show those to you now. This is another device from Propel, and I've used this one as well. I like this one better, even though it doesn't have the ability to have the light to tell you when you're at a certain depth. You still have the score marks up here you can see at 3, 5, and 7 millimeters. But again, we're just using these different devices, whatever's comfortable for you. It's one thing I love about the company and Propel is that they're constantly innovating and trying to make their products better. And to me, that's attractive. This one, we have 2 disposable tip options for enhanced clinical accessibility. The large handle fits really nice into your hand, and when you rotate and turn this, it's very stable, and I feel like I'm under control when I'm using this for my wound enhancements here. So sterilizable handle, and we're reducing the material waste. The other one was a disposable, whole unit was disposable. This one, we have disposable tips. All right. Now, let me get to this one here for a second. Now, this is an electric driver, and I just purchased this and have it in my practice. I'll show you a few minutes here, but this is on a contra angle head. It reaches difficult areas where we can perforate, and with ease. 3-speed setting ranging up to 45 RPMs. Very user-friendly. I've been using this with other TAD devices that I've been putting in for my patients now for the last 6 to 7 years. And I got to tell you, this is slick. This is fully rechargeable, and patented thread design creates those micro-osteoperfurations with ease. We'll show you more about that in a second. So this is called the Accelerator PT. It allows us to have good access to all areas of the mouth. We no longer, for those of us who might have trouble screwing these in to perforate, we know that this driver is going to make it really easy on all of us. Now, I got to say real quick, at the end of, I'll leave about 10 minutes to 9 o'clock or 6 o'clock if you're on the West Coast for questions. So if you have questions, please hold those to the end. This has ergonomic design. It's very comfortable to use. We charge it. Has optimal torque and speed. Makes it very fast, very easy. Surgical stainless steel assures the tip has strength and integrity, and we want it to be able to perforate quickly, and the patented thread design creates those with ease. Facilitates the case using braces or clear plastic aligners. And again, not talking a lot about aligners because you can use all these techniques with aligners, but we're mostly focusing on brackets and wires. Here's our components and the surgical tips. And you can see this is really, really nice. I won't go back to anything else. In my own life, I've been playing a lot of sports, and I've got tennis elbow on my right elbow right now, and I got to tell you, to think of trying to perforate with a manual device, makes my arm ache thinking about it. But now with the accelerator, this is simple. I did a case last week, and you'll see here in a few minutes, but it was simple, it was quick, and very, very awesome to use. So this ensures when we leave this in the smart charger, so it's fully charged when we need to use it. So we use it on a spur of the moment. The tip will go into a contra angle head, and we insert the blue side, and we know that that is secure in there. It's just like a latch design that we would use with our burrs when we were in general dentistry. It will seat fully. You'll know that it's seated in place. You'll press and hold the power button to turn the device on. Hopefully we'll have some videos on this eventually from Propel, and they'll show you how to use this. But we select the recommended RPMs, the torque selections, and we increase the torque settings. It really depends on the desired depth that we're perforating. And there's two modes, general mode and temporary mode. And so as you get this, I would highly recommend buying this personally. I don't have any stock in this. I pay the same price as anybody else for this, and I wish I could tell you the price. I can't remember exactly, but they're not cheap, and Propel's not giving them away. We will position the contra angle by depressing the black collar and for the access to the buttons. We confirm that the tip is 90 degrees to the point of contact to facilitate quick engagement. We depress the start button, hold it down either in temporary or general mode, and we stop when we hit the desired depth, and wherever we get to, we just hit the start button, it will stop it. We push the reverse, and it reverses right back out, very quick and easy. It's not cumbersome, and this whole process is very quick, and it makes a very clean perforation. So let's talk for just a few minutes about the benefits of these micro-osteoperfurations, minimally invasive. I get asked all the time, well, don't they just have so much pain afterwards? And there really isn't. If you've had a tab placed on your own mouth, or you've had Propel done to yourself, you'll realize that a little bit of Tylenol if you need it, and you won't have any problems afterwards. Healing's very quick. We use techniques performed chairside, and it just takes minutes to get this going. We can use this with aligners or braces. It really releases difficult movements, and I'm writing an article with Propel, and it's going to come out here pretty quick, but basically in the article I just say, it's almost like we take a tooth or a stubborn area and we turn on a light switch, and that's like we're turning on this switch that's causing these difficult movements to happen more efficiently. Really slick. Accelerates the treatment, increases treatment time, predictable and very predictable, and there's no patient recovery. Of all of these that I've done, the patients don't come back. Most of them say I didn't use any Tylenol. They're healed within 24 hours, and you're controlling this. You're not putting this in the hands of the oral surgeon or the periodontist. You know right where you're perforating, and again, you're not relying on patient compliance. You're making this happen. It saves time. There's less office visits, and basically, we want to decrease the amount of visits anyways. Other practice benefits, we're on the cutting edge of technology. My patients love to hear that our practice is using cutting edge technology, and they want to hear what the accelerated treatments are. And so it's a natural to talk about this. People understand inflammation, they understand wound healing, and they also understand that when you create a wound in the mouth, it heals very quickly. So with increased treatment acceptance, patients are more likely to accept a faster treatment time, and this is very attractive. I'll show you a case here in a few minutes of a lady who wanted to be done and treated in 7 months. I haven't treated hardly anybody in my practice in 7 months because there's too many factors that I feel need to be done in a case that I really wouldn't treat a patient in 7 months, but if she wanted that, I told her she had to have Propel and full arch, and she did it, and so we'll look at her case in a minute here. This attracts new patients. Patients today are looking for faster treatment times, efficiency, they want to be less out of their workplaces or out of school, and they want to embrace this latest technology. Now, having said that, they're also willing to pay for this. And my opinion is that Propel is not that expensive, and I don't charge per Propel time. I charge a premium fee that includes Propel, and we'll talk more about this, but it includes whether we do one set of Propel or we do another during treatment. So let's talk about using the Propel. Now, there's 3 steps, and this happens very quickly. We evaluate the treatment area. Let's say we're doing one tooth, and we have one tooth that's not moving very efficiently, or a space is not moving. We'll palpate the tissue. We'll evaluate the x-ray. Now, for me in my practice, I have an ICAT. So every patient, before they get Propel, they'll get an ICAT. We'll take a look. I'll look in 3 dimensions to see where the roots are. I'll make sure that where I'm going to be perforating, that there's nothing in the way. I think this is a great way. If you don't have this, a good Panorex is fine. But in my practice, I'm taking a nice, simple 11 microsieverts of radiation, full volume on my patients. So I feel like that's important. We're going to use Paradex. We're going to use chlorhexidine for rinse 2 times for 1 minute each. We want to just make sure we remove any microbials. And then this is what I do to anesthetize. I take the treatment area and I either use topical or a local anesthetic, and I'll leave the topical on for 5 minutes. Now, I've included in here, you're welcome to take a screenshot of this or take a picture with your camera, but I use Stevens Pharmacy. I use 10% lidocaine, prilocaine, 4% tetracaine, and phenylephrine 2%, and you can get it from Stevens Pharmacy. You can have this compounded in any pharmacy, but this is what I use, and I leave it on for 5 minutes. It says on the directions use it for 3. I find leaving it on 5 doesn't burn the tissue, and we have almost profound anesthesia, especially mesial to the cuspid. Now, if we need to, I'll use some infiltration, and I'll use a very fast-acting anesthetic, and we'll posterior, most of the time I'll infiltrate just to make sure they don't feel anything. So very simple, straightforward. Treatment considerations. Most patients will require 1 to 2 treatments. You think about this, I'm about every 10 to 12 weeks looking at redoing Propel. Complex cases may require 3. When we do 2 to 3 micro-osteoperfurations are recommended mesial and distal. I'll show that here in a few minutes. The osteoclastic response is 6 to 10 millimeters around that treatment site. So think about that for just a second in a radius. For acceleration, perforate around the rate limiting movements. So if you have a movement that's not happening, a space closure, a tooth that's not rotating, that's where you're going to really focus in, and we'll talk more about that here in a few minutes as well. Depth selection, we'll talk about this, anterior 3, posterior 5 to 7, palate 7 millimeters. And basically the osteoclastic effect peaks in 24 hours and remains elevated for 10 to 12 weeks. And there's no problem with doing this again in 10 to 12 weeks as necessary. The technique, we set the depth, rotate clockwise while applying gentle pressure, check engagement with a light tug back. It's like I said with the accelerator device, it's so nice. Once it comes, it does it on its own and you back it out, it's really slick. Now, what I found with this, I liked that light, but it was just a little bit more wound inducing to the tissues, which is why I like using the accelerator now. You can see here micro-osteoperfurations can be performed either buccal or lingual or palatal, and buccal access is the easiest and just depending, but hey, if you got difficult cuspids to bring in, why can't you do it on the palate? And you can. So here's a little sign, a little cartoon that just shows you that where you would want to use 3 millimeters versus 5 millimeters versus 7, which I rarely will go to 7 millimeters. And typically, cuspid to cuspid, I'm going to say at 3 millimeter depth, and lower canine to canine the same. Some patients may need 5 to 7 when you get to the bicuspids or to the molars. And that is something that you will find as you start using this. You will find where you need to go deeper. And I think the thing that we have to remember, we are doctors, we're clinicians, and we just use our brains. There are some areas that if you distal to the cuspid, mesial to the first bicuspid, there's a little bit of an indentation there. It's not very hard to perforate into bone in some of those areas. So we want to be smart when we're doing this. Again, how many of these micro-osteoperfurations are we doing? Where possible, we want to do 2 to 3, depending on the proximity of the anatomical structures. Perforations can be made buccal or lingual, linear, triangular, it doesn't matter. I just use them linear. I'm a big fan of staying away from roots, as I know you probably are as well. So for me, I just use a vertical pattern, and I try to do 3 perforations per area that I'm doing. You'll see a example of that here in a few minutes. So micro-osteoperfurations with aligners, we're doing that in our practices here. I have a couple of going as well, but basically we're going to perforate the appropriate areas, and we say the same thing. If there's a stubborn area with your aligners, if you find a tooth that's not tracking or problems, then it's very simple to just go in and use Propel. You can turn on certain areas to move with your aligners just by, like that light switch example I gave you. Go in and you deliver the aligners and perforate mesial to distal of those teeth that are not tracking, and then follow up in 3 to 4 weeks to see what happens. Be amazed at how these teeth start tracking into the aligners. So again, others with brackets, we want to be proactive. Maybe there's areas we feel like that we want to be proactive. I want to just touch base on a couple of things. I want to maintain the same biomechanics with the bracket system that you currently use. We're not making up some new mechanics with this or changing our whole practice around this. Now, we are shortening treatment time frame between appointments, and like I said before, the studies at NYU and others are saying 50% of what your normal intervals would be. That's what I'm doing, is I'm shortening all of my other intervals to 50% less. Still the whole while I'm maintaining the same biomechanics, the same wire sequencing, the same finishing techniques. Now, treatment at level on line fast tracks movements for more predictable finishes. Perforate mesial and distal the sites where mechanics call for the greatest movement. You'll see a case here in a few minutes where at the end of treatment I'm having trouble closing space, so I pull out my Propel, and I propelled. As in many cases that are delayed, 3 to 4 difficult movements per site, micro-osteoperfuration is the only thing that's required in those areas. So, proactive acceleration. Again, mesial and distal to difficult movement location when an arch wire is engaged. We don't have to take the arch wire out, just go in and perforate. Now, we will, on sliding mechanics, there's a little bit different here now. In sliding mechanics, in some cases, fast tracking this movement can cause a rotation if the forces are not distributed evenly. So we have to be careful here. If you go in a Propel on the buckle and then you put closing springs, if this is going to happen quickly and the space is going to close, you might get a rotation of a tooth. So you might be strategic and place buttons on the lingual of this area if you're closing space to help you with some elastics to keep and not rotate teeth. Perforations, well, with it, and for me, with using a Damon system and a door, I don't have this issue as much, but we want to be smart about what we're doing. If we're turning on an area to cause movement, then we have to be smart. If that happens very quickly, what are the adverse things that could happen as well? Perforations we talked about can happen every 10 to 12 weeks as desired, and basically we reactivate according to what we might need, and treatment finishes can be dictated by 3 to 4 difficult movements. Acceleration is used quickly to address these challenges, and so this is what it would look like post micro-osteoperfuration. And look, now you can see that the wound is healing very quickly. It's very simple to get this done. Patients may experience some tenderness around the area for 24 to 48 hours. Again, we're not using any anti-inflammatories because we want the inflammatory response. So these are certain areas. You can be creative and use whatever you want, but I've used them in crowding, space closure, molar uprighting, mesialization, protraction, distalization, you name it, you can use it. We'll remove the tip of choice from the sterilized package, insert it, and depending on what device you're going to do, I just use it clockwise, and we'll go counterclockwise to remove it. Again, these are other areas: intrusion, pre-implant therapy, congenitally missing teeth, open bite, deep bite, you name it. I'm going to show you just a couple of cases where I use this in 4 different areas in my practice. This is a case of a patient. He's missing his upper right 4. Boy, to get a restoration on this side would have been very difficult. So my treatment plan for this young man, Hubie, he was missing teeth, and he's got a crossbite, and he's got a lot of issues here. Midline's off. I should have propelled his whole upper arch and especially the specific site where we're going to open up for an implant. But I've learned I only propelled in this upper right 4 area from the 3 to the 4. But you know, these cases that are very difficult, that you thought you might not be able to treat and accomplish the goals that the patient came in for, now we can do. And if you look at this and you go, wow, what happened to the upper right 4, and how am I going to overcome that? For me, I'm going to treat this non-extraction. I'm going to eliminate cross bites, open up space for that 4. For an implant, I'm going to use Micro-Osteoperfurations, and that's what we're going to do. And this is his finished case. I don't have time to show you all the details, but look at this. This is spectacular. We performed Micro-Osteoperfurations at 8 months of treatment, and we did the distal of the upper right 3 to the distal upper right 5. 3 perforations. Within 3 months, 3 millimeters of space had opened up, and at 6 months the space was fully opened, ready for implant placement. Only one time did we use Micro-Osteoperfurations. Look at the site, the implant site. Great bone. This is a great case. So here's case number 2, opening implant spaces for previously extracted bicuspids. This is for optimal facial aging, and this is a case I include in the article. Basically, I'm going to open up for the 4 bicuspids that have been extracted on this poor lady. You can see the negative impact that she's had on her facial feature aging, and she wants a fuller smile with her front teeth brought forward for a better upper lip and mid-face. And we're going to open up the spaces, and once the spaces are open, we're going to close the molars forward once we've opened and leave the anteriors where they're at. And we'll use TADs to do this. Patient had 4 bicuspids extracted as a teenager and wasn't happy, so I proposed opening the spaces and then closing them with TADs. At 14 months of treatment, I used Micro-Osteoperfurations because the right side wasn't closing as fast as the left side. The space took 4 months to close after I did this Micro-Osteoperfuration. So you see here on her right side, the left side's almost done. this right side was having trouble. I just did the perforations, and look what we did. We got this space closed up, and things. What this does, when you will perforate, you will then make your treatment catch up to what you were doing on the other side. That's what the beauty of Propel is, that we can use this to keep tough movements symmetric. Now, stubborn space closure during treatment brackets. This is a patient that we're closing space on him, and here's Marty, a pretty straightforward case. We're going to close his spaces and broaden his smile a little bit. Class 1 should have been a straightforward case, but here we are. We're at the end of treatment, and he's got a little bit of tongue thrusting, and I initiated, to close up those last little details of space, I initiated Micro-Osteoperfurations. Space is closed 4 weeks later. Here you see we did a little bit more. At 10 weeks later, we did a little bit more to finish up that space, and obviously this was the day he got his braces off, spaces are closed, and a really nice, handsome result for Marty. Prior orthodontic treatment. Here's another place where we'll use Micro-Osteoperfurations. This is a patient that came in. She wanted to be treated in 7 months. Now, if that doesn't scare you a little bit with that buccal exostosis and bone, she'd been to another consultation and said, I want arch width. And I said, well, we can get you arch width. And she said, well, I also want to be done in 7 months. Think about that. Treat this case in 7 months. We did talk to her about placing TADs for intrusion of the gummy smile, and she opted to have this decision made later in treatment to see how things were going. So as you can tell, we initiated from day 1. This is the day the brackets are placed. I did the whole upper arch. I didn't do the lower arch. If I feel like the lower arch isn't keeping up with the upper arch, I'll go back in and use Micro-Osteoperfurations. But you can see at 4 months she's still going, and I elected to do this again to help me keep getting arch width and progress this case. Here she is at 4 months in treatment time. You can see how much arch width she's already received in 4 months' time. Other cases, this is a case that came in. This young man had his tooth knocked out when he was in high school. The tooth was out for about an hour. He went to the oral surgeon, and they wanted to extract the tooth. Well, he's coming in now to have this tooth extracted, but the surgeon says to me, what can we do? If we extract that tooth, we're going to have a huge defect, a gingival defect. And so I said to the surgeon, hey, let's do some Micro-Osteoperfurations, and let's see if we can get this tooth to come down. So you can see this is the wound that we created and the day we put the braces on. That was done just a couple weeks ago. Now, this is a case I won't take a lot of time on, but this was a case that she was been treated with 2 different orthodontists before she came to see me. She has collapsed arches, and when she came in, I was having a very difficult time uprighting the posterior segments. So I said to her, hey, would you let me use Micro-Osteoperfurations? She said, sure. So here we are. We've induced the wounds in the posterior, because that's really what I wanted. I wanted posterior arch width. So again, flipping on the light switch in the posterior to get a little bit more arch width for her. And 6 weeks later, you can see that she's progressing. And look at this. This was not more than a few months after we've done our Propel and got our arch width and a beautiful wide smile. These are the cases that we get to use. Here's other ones. Tough movements. This person has a vertical defect on the upper right tooth. The plan was to try to surgically extract that tooth and bring the tissues down with it. That didn't go so well, so we changed treatment and we moved the cuspid forward. Well, as you can see here, I want all the help I can get, so I'm going to Micro-Osteoperforate between the cuspids and even that 4 to get that cuspid to move. And this is just 2 months progress using one of Micro-Osteoperfuration. So we're moving that cuspid forward. Hey, that's a lot of movement in 2 months to move the cuspid from where it started to right there. And you can see this is him getting ready to finish up. We've got great bodily movement of the cuspid, not just tipping. That's what we want to avoid.